My name is Shari Hicks, and I'm the parent educator for the NICU. You're about to watch the new parent discharge class video. Discharge may be very soon or a little bit further down the road for your baby. We're going to cover everything from diaper rash to infant choking and CPR. If you have any questions at the conclusion of this video, please see me or one of the nurses. Thank you. Baby is ready to go home when they can stay warm in the open bassinet, feed well by the breast or the bottle, have no apnea where they stop breathing, or bradycardia where they slow their heart rate down, and they need to be gaining weight. Parents are ready to take their baby home when you have a car seat for your baby, you pick a pediatrician, watch this discharge class video, spend time with your baby and provide daily care, you learn to feed your baby, make arrangements for your baby to be circumcised if desired, and it is your OB that does that, and have a car seat available for the car seat test only if your baby was born before 37 weeks gestation. Immunizations. This is nobody's favorite thing to talk about, especially parents who have to take their kids to the doctor. You'll be given a shot record when you're discharged with at least one shot record already recorded, the HPV or hepatitis B vaccine, if you have already given consent for this. Please remember to take this shot record to all pediatricians' visits for your baby or to the WIC office or clinic visits. These are very hard to keep up with, but you will need to make an effort. Whooping cough or pertussis. Parents and grandparents need to be immunized against pertussis or whooping cough, a highly contagious respiratory disease. Most cases of whooping cough are transmitted by parents. Whooping cough is known for an uncontrollable, violent coughing which makes it hard to breathe. The cough causes a whooping sound upon inhalation. Babies aren't protected until their second or third dose, so it's important that you get yours. The Tdap shots can be obtained from your primary care physician, health department, and some retail pharmacies. It also includes the tetanus part, that's the T, so you're also protected against tetanus, which is always a good idea. Diaper care. Be sure and change the baby's diaper before he goes to sleep, after waking, and before and after feedings. There's no need to wake a sleeping baby to check his or her diaper. Be sure to always wipe from front to back with little girls. If using cloth diapers, soak soiled diapers in cold water, wash in hot water, and be sure to use a mild soap. Rinse and dry well. Diaper rash. The best treatment for diaper rash is prevention. At the first sign of a diaper rash, let the baby play on her tummy with the diaper off. Air helps heal the rash. Use ointment on the baby's bottom as recommended by your pediatrician. Never use baby powder or oil on the diaper rash. Consider the diaper wipes as a possible suspect if your baby just will not clear up on their own. Some can irritate and dry the skin. If the rash continues for 2 or 3 days, call your pediatrician for an office visit. Cord care. Your baby's cord usually falls off in 10 to 14 days. Clean the cord with alcohol at every diaper change, even after it's fallen off and until it's well healed. Using the alcohol preps doesn't hurt your baby, it's just cold on her tummy. To heal and prevent irritation, please fold the diaper below the cord until it's fallen off and healed. You may sponge bathe the baby until the cord falls off and is well healed, and then tub bathe thereafter. Formula feeding. Please don't change your infant formula unless advised by your pediatrician. If you require a special formula, the neonatologist will write a prescription for you at discharge. More about formula feeding. Always prepare formula according to label directions. Carefully measure the formula and the water. Never warm bottles of formula in the microwave. Warm in a water bath. And a good water bath is just your kitchen sink in warm water and just set the bottle in there, or even a crock pot with warm water. Store prepared formula in the refrigerator. Always discard unused formula after 48 hours. After prepared formula has been at room temp 1 hour, please discard. If your baby has sucked from the bottle even one time after an hour, it has to be thrown away. Don't carry bottles of prepared formula around all day in your diaper bag. Don't add cereal, fruits, or other solids until your pediatrician advises you to, no matter what your grandma says. Never prop your baby's bottle. Breastfeeding. You should be pumping 8 to 10 times in 24 hours around the clock. The Symphony breast pump, or the yellow breast pump that you may have used on Mother Baby or one of the two in our unit, will give you the best results while your baby is still in the hospital. Consistency is the key to making a good supply. Don't give up. Breast milk is liquid gold to a hospitalized or premature infant. More about breastfeeding. Frozen breast milk must be used within 24 hours after thawing. Don't ever warm breast milk in the microwave. Warm in a water bath, just to room temp. Call me for practice with breastfeeding while your baby is still in the hospital. I am here to help you. Bulb syringe. How to use the bulb syringe. This is the blue bulb syringe that's usually in the head of your baby's bed. First, you squeeze all the air out of the bulb, placing the tip of the bulb gently into the baby's nostril. Let the air come back into the bulb, bringing the mucus out of the nose into the bulb. Squeeze the mucus out of the bulb and onto the tissue. Clean the bulb syringe in warm soapy water, rinsing with clear water. Air dry. Environmental issues. Keep the temperature in your house comfortable, not too hot or too cold. Never, ever smoke in the house or car. Don't take the baby into crowds in the first few weeks at home. Be very particular for up to 6 weeks who touches your baby. Strict hand washing for everyone that touches your baby, every single time. Don't give the baby any medicine unless the pediatrician prescribes it or advises you to do so. When you need to call your pediatrician. Now, the day of discharge, you'll be asked to sign a sheet that says we went over all of these what ifs to call the doctor for. So you don't really need to bear this to memory. You'll get this on a sheet of paper. Fever more than 100.4 or below 97.4. Diarrhea, and that's not breast milk poop, that's watery diarrhea. Diaper rash that doesn't get better in 2 to 3 days. Vomiting, not spitting up, but vomiting. Irritable, sluggish, or unable to arouse for feedings. If the baby goes for more than 5 hours and won't eat. Redness around the base of the cord, foul smell or drainage. Yellow tone to the skin or whites of the eyes, or less than 6 wet diapers in 24 hours. Taking the baby's temperature. Use a digital thermometer. You can even use the same one we've given you in the unit. You may take an axillary or under-the-arm temp as you have here in NICU. To perform a rectal temp, apply a small amount of petroleum jelly to the end of the thermometer. Insert gently into the baby's rectum about 1/2 inch and hold in place. Hold the baby's legs firmly and never let go of the thermometer. Call your pediatrician for a temp under 97.4 or over 100.4. Sudden infant death syndrome. Always put the baby on her back to sleep. Place the baby on a firm sleep surface covered by a fitted sheet. Keep everything else out of the bed. This includes pillows, bumper pads, stuffed animals, and really even blankets. They want you to dress the baby comfortably enough to where we don't even have to use blankets for sleep. Keep everything else out of the bed. I can't stress that enough. No smoking around the baby ever. Have your baby be close to but separate from where you're sleeping. The new recommendations are next to your bed for up to 6 months is the safest thing to do. Use a dry, clean pacifier for sleep. All of our NICU babies have had pacifiers, and the recent research shows that a baby that goes to sleep with a pacifier has a decreased risk of SIDS deaths. Don't overheat the baby for sleep, and provide tummy time. Put the baby on the floor up to 3 or 4 times a day for only about 4 or 5 minutes at a time. Interact with them. They need to build those neck and arm muscles. Crying. Crying is your child's way to communicate with you. You will not, I repeat, will not spoil a baby by attending to his needs. He will not learn to manipulate you by his crying. He will learn to develop trust and feel loved when you attend to his needs. How to comfort your baby. Soften the lights. Handle the baby very gently. Rock the baby. Sing a lullaby. They love to hear your voice. Take a ride in the car or stroll the baby. Give the baby an infant massage. There's lots of good websites out there about how to do that. Swaddle the baby. And think, is the baby too hot or maybe too cold? Is the baby wet or have a dirty diaper? Shaken baby syndrome. Shaken baby syndrome is a serious form of child abuse that causes injury when an infant is violently shaken. It causes the brain to slam against the skull, damaging brain tissue, nerves, and blood vessels, causing the brain to swell. It may cause behavior problems, partial or total blindness, hearing loss, seizure disorders, mental retardation, or developmental delays, cerebral palsy, and even death. Symptoms of shaken baby syndrome: extreme irritability, lethargy, lack of appetite, vomiting, difficulty breathing, semi-consciousness, and even seizures. How to avoid shaken baby syndrome. Take a break when you're feeling frustrated. Everybody gets to that point. Place the baby in a safe place on her back and take a breather. Ask someone for help. Call a friend or family member for support. And make plans to have a day away from the baby if possible. It will do you both a world of good.